For many, many years, critical care was kind of fly by the seat of your pants. You know, there were not a lot of studies proving that one therapy or one mode of delivery of therapy was better than the other. There is some opportunity to standardize care, and it really does make a difference in outcomes.
I was going to try to engage physicians and other clinicians on the basis not of money, but appealing to their value system around what's the very best thing we can do for patients. If we can demonstrate to them the principles of variation, reducing variation, shifting reliability, then money suddenly doesn't matter. Forget about trying to identify the culprit. Let's just start identifying best practice. They dropped their guard about whether they were going to be under scrutiny and started engaging in productive discussion.
We have two choices. We can choose not to address this concern and do what we think is best, completely irrespective of cost. Then other people will make that decision for us. It'll be CEOs, CFOs. If we really want to be able to advocate for the best care of our patients, then we need to be involved in that decision and that debate. I would rather it be physicians making clinically based judgments than CFOs making judgments based solely on what the highest target is.
If you walk into a room full of physicians and you say, you need to decrease this or you need to eliminate the use of this, you've lost them. Start the conversation about patient care, start the conversation about quality, and how somehow we're going to, by either decreasing variation or decreasing costs, that ultimately is going to translate into improving care for patients. Physicians are going into their job every day and they're saying to themselves, I don't want to hurt people. So I'm not going to change my practice because there's a risk I might hurt people. But when I hear that this change in practice benefits patients and they get better outcomes, and it's not some study that was done over in Europe or on the East Coast or wherever, it's somewhere that was done here. We did it. We are getting those good outcomes, and this is our patient population. And that's something that surgeons really gravitate to.